is a mandatory meeting for all the Remar nurses. It's time for Monday motivation and let's talk NCLEX. This is what we have been waiting for all weekend, really. Hello, everyone. I'm in Ohio. Where are you from? Where are you at? I see Texas in the house. I know Florida's going to be here representing, but this is Monday motivation. Let's talk NCLEX. I'm excited about this Let's Talk NCLEX. You know what? I really appreciate you guys. I really appreciate all the love. People are looking for me on Mondays. And it's a beautiful thing because you guys know that with everything going on, we still have to find time to come together. So I got Michigan, Brooklyn, New York is in the house. Georgia, thank you for hanging out with us today, representing the entire state. You just put like Georgia, so you must be Miss Georgia. Hi, Jacqueline, watching from Connecticut. I appreciate you guys being here. The numbers are climbing. I'm so happy because the Let's Talk NCLEX will be brought to you from the 5-Star Quick Facts. Hey, Audra from Daytona, the 5-Star Quick Facts. And so this book has been my best friend for several years now, but I am happy to be bringing, yes. You guys, when we do Monday Motivation, Let's Talk NCLEX this week, actually, I'm going to talk more about that because you guys know that, I don't know if you saw the comment, but I did lose my grandmother last week. And so everybody was so supportive, and I'm trying to let people come in because I really want to talk about the love that I felt from the Remar nurse community this past week. So Alden said, I can't help but being here. I know it's such a good time. Literally, this is a bright spot of my week. And the weeks are so busy. Like the days are so busy. But coming here is a high point. So if it's your first time here, I don't know if you know me, but I'm really happy to be here. My name is Regina Callion. I am the #1 NCLEX instructor on this planet. I'm owning it. I'm just owning it for this year because I really find that the lengths that I'm willing to go to for NCLEX, they surprise me, even myself. And so I'm here with you guys on a regular basis, just trying to motivate you, trying to do what maybe you didn't have done in nursing school. I mean, maybe you didn't have an instructor that was willing to go over information. I don't know. Maybe you guys didn't focus on clinical scenarios and medications. That may have been your experience. But here, I pride myself on those things. I really do, because it's needful. And as I study more for NCLEX, for R&R, for whatever, I know that spending time with nursing students and us coming together, Gilly, don't be anxious. Is so needful. So I'm happy for everybody that's here. All that says check my P.O. box. I do need to check my P.O. box. I do. I'm going to do that too. All right. So my name is Regina Callion. I'm here with you today. Once again, we will be doing a Monday motivation. The topic is, now is the perfect time. Now is the perfect time. So if you're testing, some of you may be testing tomorrow. I don't know. Some of you may be testing tomorrow, but now is the perfect time. Don't be anxious. This is what you were born. Like, God knew that you would be born during this time and you have a purpose. And so today we're going to be talking about that. I was waiting for somebody to comment on this hairstyle. It took you guys way too long. This hairstyle went with me to my grandmother's funeral. So it was kind of like a throwback hairstyle. I just had to really prepare myself. I'm going to talk about this, okay? But listen, check this out. The Remar nurses are studying for NCLEX. studying everywhere. No location is safe. So I got this picture last week and I think, oh my goodness, I thought it was just hilarious because literally, she's like, I'm getting a pedicure, but I'm not just getting a pedicure. I have to be studying. What kind of motivation must you have to pull out that book in the middle of the salon like that? Oh my goodness. I loved it. So, just the fact that Remar nurses, you guys are out here studying, you're out here passing this test, your priority. Oh, I love it. So I had to show it. And in the Facebook group, I know there are so many there's so many pictures and videos that I haven't even gotten a chance to just digest, but I'm going to sit down and collaborate and then show you guys all of what the Remar nurses are doing. Oh man. So we're studying together. Today we will do Monday motivation and we will do Let's Talk NCLEX. I'm just building up the time. Okay. I'm just building up the time. So the Monday motivation really comes from my grandmother this week. And it's I like how it's a different perspective. And I want to thank you guys for all of the condolences. One of the Remar team members, LeBron, he got on Friday, I believe, and he just let everybody know that I was at my grandma's funeral, and we just started getting the condolences and the love from you all. And as many of you, I imagine you have maybe experienced loss in your family at some point. So you know what it's like, and you know how it can bring a family together. Some losses can make families closer. And so I think our family, we had an ideal situation. My grandmother, she was headed towards hospice, and before she actually had any hospice care or assessments or evaluations, she passed. And so we were there. We were there when it happened. And as surreal as it was peaceful in the sense that you had a family member go in their own way. Like it wasn't forced by a medication or some tragic event. Our grandmother was 87 years old. So around her family, around us praying, as she transitioned, we recited the 23rd Psalms, and it was just a moment, I think, that will bond us even closer. But during that time, during her losses, you're prepping for a funeral and you're making the arrangements. As some of you may know, you really get to reflect on that person as you attempt to celebrate the life. As you attempt to celebrate the life, you get to reflect on the achievement. And my grandma was really cool, like really cool. When you think about your grandma, you think about your grandma like in her elder years, but my grandmother as a young woman was phenomenal, like phenomenal. And so I'm going to talk about her a little bit for my Monday motivation, if you guys don't mind. All right. So let me tell you about my grandma. Let me tell you about my grandmother. So the title for this Monday's motivation is this: even when the circumstances are not ideal, now is the perfect time. I want to say that again. Even when the circumstances are not ideal, even when the things around you may not be great, they may not be perfect, the timing is now perfect. So my grandma, right? My grandmother went to school during a very interesting time in America. All right. My grandmother was extremely educated, like surprisingly so. So listen, so she graduated from high school. Then she went on to college, paid for her college education by playing the piano in church, right? Playing the piano in church. And then after she got a college degree, she went right back to school and got a master's degree, paying for college herself during a time when African American women were pretty much marginalized in society, right? during the 1940s and the 1950s, you guys know the condition of this country during that time. This is pre-segregation. This is during segregation. Like, this is a time when there was a separation of facilities between blacks and whites. Like, my grandma was in college trying to pursue higher education when blacks were not even considered like equal. Can you imagine the strength? Must have, like, the circumstances of the 1950s. You had segregation. You had Brown versus the Board of Education, where in a Supreme Court, they're trying to figure out if black and white facilities were equal. Like, should they be separated? Should they be like, this is the time where, as a black person in this country, you already had a ceiling. Like, they talk about the glass ceiling now. No, there was a ceiling for blacks. Like, the education was limited. Your employment was marginalized. Like, if you were going to do something, you were going to be able to do it to a limited capacity. Like, me just getting on here and speaking to people of all different colors, like, that was not happening in the 1940s, right? So my grandmother, like, pushed back on what society was trying to, restrain her with. And so as we're reflecting on her life and I'm learning about her, and Mark and I, we're just really amazed at the accomplishments. And it's just like, man, grandma was all of that, like getting that education at the time. And so even though the circumstances, and this is for my grandma, like, and this is for you too, and this is for myself, even though the circumstances were not ideal, the time for her was perfect. She did not sit around and say, you know what, I really need to wait until they figure this out. Because this is a time when the civil rights movement was just beginning. Like, in the 50s, people were trying to rise up and say, hey, this wasn't right. My grandmother could have been like, you know what, I'm going to wait this thing out to see, if maybe I can get into a different school, or maybe, a different opportunity would open up. She said, no, things are not perfect, but I'm going after this goal. Like, and so for us this week, the situations may not be ideal. I don't know. Like, it may be not the greatest that you have to work and go to school. It may not be the greatest that you have to spend your last dollar, but the time is perfect. Right now is what you have to work with. So it can't help but being perfect for you. And so I just thought that this story about my grandma in the 1950s was so motivational not only for me, but I hope for you guys. And so again, like, this week, the circumstances may not be ideal for you. There's going to be some barriers. There's going to be some challenges that you may have to face this week. But what does that mean, really? In the grand scheme of things, can you overcome it? Can you push back against it? Or are you going to wait around for it to get better? My grandmother didn't wait around for it to get better. She went to college in the 50s, like, in America. She went to a postgraduate school and got a master's degree. My grandmother was a teacher. She got a master's degree in education, like a master's in education at the time where Black women, they weren't even probably able to be, and I'm speculating here, but they weren't able to. Valerie, right, you did have some major struggles, and I'm so happy that you got through it and you persisted. That's so true. That's so true. But at a time when Black educators weren't offered, college professor positions, she went on ahead and got the master's in education. And my grandmother, you know what, even with the master's, I'll say this, even with the master's, she taught elementary school. Like, even with her obtaining a master's degree, because of the times, because of the politics, she was teaching elementary education. But did that stop her? No. She ran that elementary education. You know what I mean? Like, she retired as a teacher with a master's degree in the 60s, in the 70s. Oh, man. Whatever your circumstances are, I'm hoping that this story motivates you to think and believe that you're unstoppable. And not only because you're just like, just super blessed and super lucky. You are, but there has been others before you that have set the path for you to do great things. So let's recognize all that people have done so that we can be where we are. And I would say that if our ancestors, of people who have struggled great atrocities, for us, the comforts, and every American, not just Black, not just white, like every American here, we have certain liberties, we have certain privileges, because, to be honest, people died so that we could have them. So who are we this week to be sulking and complaining about the struggles that we must fight on a day-to-day basis? I think that the Bible is really clear that the things that even we go through are very temporary and momentarily considered to all of eternity, everything. And so as we're trying to process what our week should be like, what our week should look like, let us come from the perspective that we already have the advantage. We are highly, highly positioned for greatness, for success, because of the groundwork that others have laid before us. I mean, literally, if you just keep putting one foot in front of the other, you will move forward. You will have progress. There's no reason for you not to. You have everything that you need. You just have to use it. I'm serious, you guys. I'm serious. I like that. Somebody has put in a tremendous amount of work, a tremendous amount of prayer, a tremendous amount of sacrifice so that you can be exactly where you are today. I don't care who you are. I don't care who you are. You are set up for success, man. And I'm just so grateful. And I thought I had a picture of here, but I don't have a picture. But my grandmother, she was a first lady of a church. Like my grandpa, he was a pastor of the church. Go figure, right? So these two, they put in a tremendous amount of work in the ministry field so that myself could be prepared and be trained up in a way that a child should go. And not only me, but all of my family. And so I am coming here to motivate you guys to really consider your family members that were before you, the older ones that prayed for you, that worked hard for you. I know I'm not the only one. I know it. So this week we're doing it to honor the sacrifices of those who have been before us. Those who have been before us. And no matter who you are, I know you can think of that one person that just inspires you and motivates you. Who is it for you? Who is it? And he says, that's in my life motivation. Yes. Think of that one person. All right. And it could be a family member. For me this week, it's my grandma. I mean, it's my grandmother. And I like that. With God's help, we can do anything. And that is so true. That is so true. Valerie says her grandmother. Yes. All right. So is it grandmother day? Is it grandmother day? Where we're just really proud of the work that our grandmothers, my husband, my parents. Okay. Deborah says my daughter. I like that too. I like that. So it was a sad time. It was a sad time. It was a tough time. But when you have a community, that can sing you love and that you can talk to and dialogue, things are so much better. I was doing a report and it said, like, the happiest people in the world, the things that make them the happiest. They did a study. It was a Harvard study over like 75 years. And they found out that really in America, happiness or factors of happiness have really not changed that much. Like the same things that made people happy 100 years ago are making people happy today. Like as much technology and everything that we have. But the factor that made the happiest people happy was their ability to have social relationships. So the family in their life, the loved ones, the community, the friends. And I'm so happy. I'm so happy that we have this community here at Remar. And I'm also so happy for your individual family members that motivate you and encourage you, because it's such a big part of your overall success. If you don't have someone to share good news and happiness with, you're going to have a very hard time in life, because other things really don't matter. Money doesn't matter. People, praising you and things like that. What matters is those who are really close to your heart, and those you share bread with, and those you share your life with. Those are things that money cannot buy. And so, I'm really comforted to read all of you all who have family members that are inspiring your life. Katie says, my son and my mother are my motivation. My son and my mother. Gotcha. Okay, so we're just talking about motivation. We're talking about the motivation that we need for this week to be successful. So I say all that to say, I hope that you guys are motivated. I hope that when you watch this, whatever time it is, you will be able to find inspiration for the week. I'm reading it all. However, we have to do the second part of Monday motivation, which is what? Which is Let's Talk NCLEX, and I am loading up. I'm not going live on YouTube today. It'll just be on Facebook. However, my slides are taking a long time to load up for me today. I don't know what it is. So I'm going to read some motivation here just really quickly to show my dad is my motivation. I appreciate that. Valerie says, Miss Regina, you are my motivator, getting me through NCLEX. I can never be more grateful. I appreciate that, Miss Valerie. If you haven't checked out her video, please do, because it's really, really inspiring. It's really, really inspiring. So we're going to do Let's Talk NCLEX. I just don't know why my slides are looking for me. Yeah, sure. Okay. All right. So do you want me to keep?
Yeah, just like 5 seconds.
Okay. Together, I'm thanking you guys for being with me here today. We are going to just keep on going as much as I can here. Let me bring it back up again. Bear with me, guys. Let's see. I don't know. I don't see it. Technology. Let me try it again. Let's see if I can get it. I don't know. Trying to bring it up. It's just not letting me today. I don't know. Okay, guys, let me see. Let me try one more thing. To see if this is going to work out for me with the motivational. I can't get it to come up. Okay, let me try. Let me read this testimonial as I'm trying to give the computer time to load up. It says, good day, Miss Regina. My name is Sadhu. I just want to let you know that I passed my NCLEX RN on Tuesday, February 12, 2019. I brought your DVD, The Complete Set, last year, 2018. I want to thank you and Mark for your product on my exam. You got 75 questions, 27 select all that apply, 1 math, 1 drag and drop, and 3 pictures. Okay, thank you for coming and telling us that. Passing NCLEX in 75 questions is always a good thing. It really is. Okay, are you guys ready? We're going to do some Let's Talk NCLEX questions right now. get out your pens and paper. I do think that you guys will learn a lot from this broadcast because of the topics we're going to talk about. Not only do they come from the 5 quick facts, but as I was studying, I came across some things that were very beneficial for us to know. So let's do the first question. Shall we? Here we go. First question is, here we go. The nurse checks the client's pulse and notices the pulse is easily felt, however, disappears with moderate pressure. Oh, I'm going back to the basics here. She should document as, and again, we have the client's pulse is there, it's easily felt, however, it disappears with moderate pressure. She should document this as 1+, 2+, 3+, or 4+. What saith you guys? What saith you guys here? Come on in. We're doing Let's Talk NCLEX. The Monday motivation has been served already. What do you guys think for this pulse? How did you document? How did you document this pulse? Should a pulse disappear with moderate pressure? Or should the pulses remain? I'm trying to give you guys something to think about. When you're taking a pulse, do you expect it to disappear if you put some pressure on it? Is that normal? Is that abnormal? Is that normal? Is that abnormal? Again, this is how I do my NCLEX questions. When I'm doing questions, I'm not looking just for an answer. I'm looking for understanding. And this is why I tell you guys, content first and then do questions. No strategies. Don't email me, say, what are the test taking strategies? I don't have any strategies. I really want you to dig into things that you're unfamiliar with this test. So I see the answers here. I see 1s, I see 2s. I see a lot of 1s, I see 2s. Glad I went over this today. Because the correct answer is 3. A 3. And you guys know that 3+ is a normal pulse. So get out your notes and write this down. Here we go. So when we're looking at a pulse, the pulses can be described using 4 numbers. And the numbers actually are not just random numbers. They're going to represent certain characteristics. Okay? They're going to represent certain characteristics. So if a nurse documents a pulse to be 0, then that means the pulse cannot be felt. And this may be new to you guys, so don't just reject something. Like sometimes you guys will see things and you'll be like, no way. Be open to learn. Be open to learn something, okay? All right. So here we go. When a pulse is 0, that means that there's nothing. Okay? That means that there is nothing there. A 1+ pulse means that it's a thready pulse. All right? The pulse is present, but it's difficult to feel. All right? And even applying the littlest pressure will make that pulse disappear. Now, because the pulse is represented an artery beating, a vessel beating, if you put pressure on that vessel, then that pulse will not be there. But there's a certain amount of pressure that should stop a pulse from at that location. All right. So a 1+ pulse is a thready pulse. Okay. 2+ pulse is a weak pulse. It's stronger than a thready pulse, but if you put light pressure, that will cause the pulse to disappear. So what I want you guys to be open with today is understanding that pulses come from arteries, right? Number 1, pulses come from arteries. And number 2, with the presence of pressure, a pulse cannot be felt. Okay? A pulse will not be felt if you put a certain amount of pressure on it. So that's why when we do a pulse, We don't just slam our fingers down. We don't just slam our fingers down on the patient and say, oh, there's no pulse there. You have to understand that you're feeling for an artery first. Okay, you're feeling for an artery first. So it's important for you to use the appropriate amount of pressure. Okay, so, all right, hello, everybody. All right. 3+ pulse is considered normal pulse. The pulse is present, okay? Just because the pulse is present, that doesn't mean that it's normal, but the pulse is present. It's felt easily. And if you put some moderate pressure on that artery, it's going to disappear, okay? It's going to disappear. Now, a 4+ pulse is an abnormal, right? It's an abnormal. The pulse is bounding. Maybe the client has some hypervolemia going on. There is something that needs to be investigated, okay? So the pulse is strong. The pulse is strong. It does not disappear with moderate pressure, all right? So these are just characteristics of a pulse that you guys can be familiar with. And there's nothing wrong with learning new things. There is nothing wrong with learning new things. It is okay. All right. All right. Don't put too much pressure on those pulses. All right. Okay. So we're learning. We're coming here to learn. We're coming here to learn. Congratulations, Ebony. Congratulations. Yes. I am so happy you passed that NCLEX PN. Thank you for coming on here. Thank you, Nurse Boinkins, for coming on here and telling us that you passed. All right. Okay. So are we good on this? Are we good on this? Everybody understands? Everybody took the notes? I just want you to take notes. I want you to be open to learning when you come here. We're here to talk about NCLEX. We're here to discover new things, but we're also here to share our knowledge too. It's not a medium. It's not a medium for conflict or controversy. Sometimes I know we get on those group posts and we like to go back and forth about what is the right answer. And people are so upset because they ran into a disagreement on a Facebook post. But guys, this has to be a community of openness and learning, okay? All right. So what I want to do is I want to go to a clinical scenario, okay? And I want to run clinical scenarios with you guys today because I really want to demonstrate how if you understand content, you can answer any situation that NCLEX gives you, right? And so I just wrote this clinical scenario last night, and my goal is for me to introduce a client to you guys and for you in real time to formulate what is going on with that patient, because that's a way for me to see if you guys really have a true understanding of nursing information. And also at the same time, it's for you to evaluate, are you able to make appropriate clinical judgments, right? And so it's a twofold thing. And I think that this is what should be done more in nursing schools. But because it's not, I'm happy to do it here. I'm happy to do it here with you guys. So are you guys ready for the clinical scenario? Are you guys ready to learn? If you have a friend who is studying for NCLEX, you need to share this video right now. We're doing some clinical scenarios here. All right. So this comes from 5-Star Quick Facts. You would not believe it, but I'm telling you, it comes right from this book. So let's get ready to dive into it. Let's get ready to dive into it. Here we go. A 45-year-old woman presents to the emergency department stating she is having severe pain. She stated the pain started suddenly. During the initial assessment, the client vomits on the floor. Which is the best action of the nurse? Which is the best action of the nurse? Number 1, ask the client to change into a hospital gown. 2, take the client's vital signs. 3, start an IV access. 4, ask the client to identify the location of pain. What is the priority here in this clinical scenario? So again, I need you guys to pick the priority, and I also need you guys to remember this patient, because this is the patient we're going to be following throughout the next couple of questions, okay? Throughout the next couple of questions. So we have a woman, 45 years old. We don't know that much about her, but she says she started having pain suddenly. During the assessment, the client throws up on the floor. What is the best action of the nurse right now? Should she, number one, ask the client to change into a hospital gown? 2, take this client's vital signs. 3, start an IV access. Or 4, ask the client to identify the location of the pain. So in our common NCLEX, in the common NCLEX community right now, there are many, many different answers. There are many different answers. Oh, I'm so happy we're doing this scenario together today, guys. All right. So I got to keep going. I got to keep moving this. I got to keep moving this clinical scenario. You guys are doing great. You guys are doing a great job. The correct answer for this situation at the moment is the nurse needs to ask the client right now, where is the location of the pain? Okay, we need to know where the pain is coming from. The vital signs, no. Right now, if a client comes in, they say, I'm in a lot of pain, and while they're talking, they throw up on me on the floor. I need to know where that pain is. Is it chest pain? Is it back pain? Is it leg pain? What is going on? I could take the vital signs, but are the vital signs going to tell me anything about the issue that the person is talking about? No. So we need to ask the client to identify the location of pain. This is part of the assessment, right? The nurse needs to investigate the reported pain for, number one, location, the location and intensity. The vital signs, again, they are important, but the location of the pain will directly impact the necessary treatment. Okay, right? So somebody's saying, I like that. It could be pregnant. The patient could be pregnant. I don't know. So you guys, this is part of clinical judgment. This is part of clinical thinking, right? Somebody comes in, your focus, you have to assess this patient. You have to know what's going on. Where is the pain? I like how somebody said it. Oh my goodness, the pain. That's so general. Somebody says I'm in a lot of pain. I could be thinking chest pain, but they're talking about a headache. So we have to know that. But let's keep going. Let's keep going. We're learning. We're digging deep today. This comes from Quick Facts. Here we go. So the nurse receives notification that the current laboratory results are available. Let's look at these lab values. Let's look at these lab values. So we have the white blood cell count, 10,000. The hemoglobin, 13. The hematocrit, 36%. Platelet count, 325,000. The MCH, 30. The AST, 684. The ALT, 880. Remember the patient. Look at these lab values. Is anything that concerns you? Because we have a question. Following this, but here are your laboratory values. You got to know what these all mean. You got to know what these stand for. And sometimes NCLEX will throw you a ringer in there and you will be like, what is that? What is that lab value? I don't know it. Oh, you got to know it right now. Looking at it, Remar nurses, look at these lab values. All right. And the question is, which laboratory value are the most important at the time? This is a select all that apply question. This is a select all. Which laboratory values are the most important at this time? Oh my goodness. Which laboratory values are the most important at this time? What do we need to report? This is select all that apply question. All right, select all that apply. And it's okay. It's okay. If you don't know some of these, then guess what you're going to do after this broadcast? Guess what you're going to do? You're going to do the right thing. You're going to do the right thing for yourself. Let me give you the answer. All right, let me give you the answer. Correct answer is the AST and the ALT. They're too high. They're too high. So we look at these laboratory values. We're going to have to report these to the physician. We're going to have to report these to the physician. The white blood cell count was normal. The hemoglobin was normal for the age. The hematocrit was normal for the age. This is part of the clinical judgment that NCLEX requires you to do based off of what you learned. All right. So in real time, you have to be able to navigate through a scenario. All right. The platelet count was normal. The MCH was also normal for this age and this person. The AST and the ALT, they're very high. They're very high. What is the normal values for AST and ALT? You better know them. You better know it, because we got to move on. We got to keep going. We got to keep going. Yes. If you don't know, what does it mean? What does MCH mean? What does WBC mean? Oh, these are fundamentals of nursing. These are the fundamentals of nursing that NCLEX is going to assume that you know. So they may not write out. They're not going to write out what hemoglobin is. They're going to use the abbreviations, because you're a professional. You already know what they mean. Okay. All right. So let's keep going. Let's keep going. So we have the same client. Thank you guys for hanging with me. We've been studying for almost an hour. Oh my goodness. I need my computer charger, or this whole thing is about to go off. So here we go. The client points to her stomach. She rates the pain 10 out of 10. She rates the pain 10 out of 10. The client vomits again. Okay, so check out the location of pain. The client vomits again. The nurse takes the vital signs. These are the vital signs. Check them out. The blood pressure is 120/75. The heart rate is 110. All right, the heart rate is 110. The respirations are 20. All right, got that O2 at 94%. And the temperature is 37.4, and that's Celsius. So here we go. Which is the priority nursing diagnosis for this patient based off of what we got here? So knowledge deficit, number 1. Risk for fluid volume deficit, number 2. Number 3 is alteration and comfort. And 4 is risk for falls. Oh, wow. It looks like it's unanimously number 2. Isn't that interesting? It looks like all the REMAR nurses all over the planet have come together and picked number 2. Is that what I'm seeing? Number 2, dehydration. The client points to her stomach, rates the pain 10 out of 10. The client vomits again. This takes the vital signs, and they are 120/75. Blood pressure, heart rate 110, respirations 20, got an O2 of 94%, and you got a temperature of 37.4. Oh my. Okay, I have some 3s now. I have some 1s coming in. What are we going to do here? I need you guys to really think about this clinical scenario, okay? This patient is depending on you. This patient is depending on you as the healthcare provider to address their needs. And NCLEX wants you to get to the root of the issue. I want you to get to the root of the issue. So I'm seeing all the answers here. Guys, the correct answer is going to be, let me show you. It's the alteration and comfort. Of course. You have a patient that comes in. What is the complaint? The complaint is sudden pain. It's sudden pain. The patient comes in and says, I'm in pain. I mean, it's the first thing that they say. And then also, we get some information here. They're rating this pain a 10 out of 10. How bad is that pain? 10 out of 10 means it's the worst that they could ever stand. They're pointing to their stomach. Yes, they're vomiting. Yes, they're vomiting. But the priority here is the pain. We have to do something about that right away. Does that make sense? All the vital signs are stable. The vital signs look good to me. You got that heart rate. The heart rate is a little high, right? The heart rate's a little high, but could that be because of the pain? Could that be because of the pain? Yes. As the patient, the heart rate is just a response. It's a sinus tachycardia. There's nothing wrong with the heart. The rhythm is increased because of another factor, and it's the pain. All right. So when you're doing these questions, it's important that you go with your first mind and really you go with the obvious, right? I don't want you guys to get too deep, because if you think about dehydration, it takes a while for a patient to be dehydrated, right? It's going to take you, how long does it really take you to be dehydrated, where you're having dry mucous membranes, where you're having, just issues where you're just drying out? It's going to take you a while. All right. As opposed to the pain is happening right then, right now. It's the priority. Okay. So this is how, with these clinical scenarios, we get frazzled and we get off track. But I want you to see here, how do you need a strategy? Do you need a strategy to figure this out? No. You need to read what you're given. You need to rely on the facts. Now, you guys may be thinking, well, Regina, I thought you said pain was secondary. Yes, what I want you guys to think about is, don't try to apply strategies. All right. This is not a priority question where it's like, okay, which patient is the worst? These are conditions for the same patient. So all of these things apply to the patient. What do you need to address regarding this one patient first? Okay. So it's not a matter of priority in terms of looking at 4 different people. This is for your patient. What is the most important thing for you to address right now? Okay. So I need you guys to look at what you're given. And sometimes it's best if sometimes it's best if, and this is what I tell you guys, reset after every question, like in terms of looking at what you're given. Okay. Don't try to use any kind of tips or tricks from other areas and bring them into here. We're not talking about priority of 4 different people or 5 different people. This is one patient. For your one patient, what is the most important thing for the nurse to address? Okay. All right. So let's keep going. Because there's more with this patient. So now we have here, and let's reset and let's get into it. Okay. Let's reset and let's get into it. Sometimes somebody may need to take a deep breath. Let's just take a deep breath. Okay. Here we go. All right. So this is epigastric pain. We know it requires immediate intervention. Okay. It requires immediate intervention. Next question. Okay. The client lays down on the bed and lifts up her shirt. There is a blue circle around the umbilicus. How should this be documented? Number 1, Turner sign. 2, Cullen sign. 3, Chadwick sign. 4, Homer sign. Pick an answer without looking it up. I'm looking for the people who know this answer without looking it up. Okay. The same patient that's complaining of epigastric pain, you guys should all know what the diagnosis is right now. Absolutely everybody should already know what direction this patient is going in based on the laboratory values, the pain, the vital signs. You guys should already have the diagnosis, all right? And this is straight out of Quick Facts. So if you study Quick Facts, you know this. But anyways, so the patient lifts up her shirt and there is a bluish circle around her umbilical area. What is this? What is this? All right. Clinical scenario. We got a patient. She was throwing up all over the place, throwing up all over the room, says she's in pain. Oh my goodness. What should we be documenting this as? The answers are rolling in. This clinical scenario is getting good. It's getting even better. I love Let's Talk NCLEX because we get to do these kind of things together. All right, we're pressing in. 500 nurses on this broadcast. Wow. All right, here we go. The correct answer. Oh, this is Cullen's sign. Welcome everybody. Cullen's sign is that superficial edema and bruising around the umbilicus. Oh yes, Cullen's sign. All right, here we go. I gotta move on. It's almost 1 o'clock. 1 hour strong. Here we go. Oh, the nurse taking care of this patient now. The doctor decides to write some orders. All right, so here we go. So our patient who we've been taking care of, you guys know her now. All right, the healthcare provider has written the following orders. Which should the nurse question? Should it be number 1, ultrasound of the abdomen, stat? 2, a diet of NPO. 3, amoxicillin IV 500 milligrams every 8 hours. 4, lactated ringer 100 milliliters hourly. 5, insert NG tube to low intermittent suction. Okay, here we go. We are looking for what are we going to be questioning? All right, with our patient. I'm looking for the Remar nurses who know this answer or at least willing to try. I'm okay if you don't know it. Just try. Commit to something, but have it to make sense to you, okay? Think about the patient's condition. It's only one correct answer here. Think about the patient's condition, the possible condition, which you guys have been given enough information. You've been given enough information to know. So think about the possible condition and then think about, what doesn't seem right? What doesn't seem right about this treatment? Okay. Again, the choices are ultrasound of the abdomen, stat, diet of NPO. The condition hasn't been revealed. You have to use your clinical judgment based off of what you know about the person. Amoxicillin IV, 500 milligrams every 8 hours. Lactated ringer, 100 milliliters hourly. 5, insert nasogastric tube to low intermittent suction. What seems strange? What seems out of order to you guys? Oh, this is a good one. This is clinical judgment. Insert NG tube, low intermittent suction. You guys, I love it. We're digging in. We're participating. I love the participation. I just love the participation for today. You guys are going in there. Okay, not 2 answers. Not 2 answers. 1 answer. 1 answer. I want you guys to be able to commit, okay? One of the hardest things for NCLEX is just being able to commit, and we're wrestling with 2 answers Just pick one. Just pick one. Just pick one. Okay, so here, the correct answer, the one we need to question, bam, that amoxicillin IV. What, doctor? What? Why are we giving, what? Amoxicillin every 8 hours for what? Why are we giving that? Well, of course you wouldn't say it like that. But think about the patient's condition. Think about the patient's condition. What are they leaning towards? What did we study in the 5-star? What did we study in the 5-star? That the patient has all of these signs, okay? What did we study? You got it right. Congratulations. Okay, so in the 5-star, we studied that, listen, a patient comes in, they come in with epigastric pain. It's severe. It's so severe. They're vomiting. They're nauseated. They're vomiting. Then what happens? We look at the labs. We have an increased AST, ALT. Everything else is normal. The vital signs are stable besides the heart rate. Then the patient lifts up their shirt and we have Cullen signs. So we know that this is what? This is pancreatitis. This is acute pancreatitis. So if I'm looking at these orders, okay, you want to see an ultrasound of the abdomen? I'm okay with that. That's cool. We can look at that. A diet NPO? Absolutely. I don't want this person eating. They're vomiting. That means that they already have stomach distension going on. I don't know. We got to decompress that stomach because they're vomiting, right? Lactated ringer. Yes, we're going to give it IV, right? Because the patient is on the road to dehydration with the vomiting. They can't eat. Yes, we're going to insert an NG tube to decompress the stomach. We're going to put it to low wall suction. Don't hate the case study. All right. And use this to motivate you. The NG tube with the low wall suction, that's going to help because that suction is going to help to reduce the fluid production that's building up. That's how you decompress the stomach. You do it slowly. You don't want to just remove everything from the stomach at once. You want to intermittently do it, right? But pancreatitis, what is the cause of pancreatitis? What's the number one cause of pancreatitis? Like really. People who get acute pancreatitis are usually what kind of people? Are they people with viruses or bacteria that need antibiotics? No. Pancreatitis is very rarely caused by some sort of virus or bacteria. Pancreatitis is mostly caused by, yes, good job. It's mostly caused by alcohol abuse. It's mostly caused by somebody who is drinking way too much. So does this patient need a round of antibiotics? Very powerful penicillin? No. Not at all. So I'm going to question that. I'm going to look at that and say, what are you concerned about here, doctor? Well, what are you worried about that we're going to give this patient some antibiotics? Okay. So this is how you're going to run any kind of clinical scenarios. You have to be proficient in the content. I mean, if you are looking for a strategy or a decision to help you during this time, it's going to be difficult for you. And yes, Christina, I love that. You definitely, even after you pass, you can still study. You can always study with me because we're learning together. I was writing this scenario like, yes, this is amazing. I love it. Okay, but we're not done. How about we keep going? Let's press a little bit more. Because now I told you, I don't even think I was supposed to tell you the diagnosis, but that's just how it happened. All right. So let's press a little bit more into it. Okay, let's press a little bit more into it. Here we go. Now that I've revealed the diagnosis, which pain medicine is going to be the best option for this client? I'm going to give them some acetaminophen. We're going to give them a little acetaminophen PO. We're going to give them some ketamine, 2 milligrams IV, midazolam. We're going to give that 1 milligram, hydromorphone, 1 milligram IV. Which one? Which one? Just one. Which one would you, if you were thinking about what your client really needed in their best interest, what would it be? What would it be? The choices are coming in. The choices are coming in. Don't try to look it up real quick. What makes the most sense? Okay. I see you, Remar nurses. I see you guys. You're with me here. You're with me here. Okay. All right. Is there not, everybody's picking 4 for the most part. Everybody's picking 4 for the most part. Hydromorphone. All right. Got to know hydromorphone for NCLEX. Might know it as Dilaudid, but you better know that generic name. If you got the 5-star, you go ahead and you go ahead and put the answer from the 5-star. You'll get it right. You'll get it right. All right. The correct answer. Good job, guys. Good job. The correct answer is number 4, hydromorphone, and that's okay. That is okay. The correct answer is hydromorphone. It's also Dilaudid. That's okay. All right. If you didn't get it right, don't worry. Today is the day that you just are able to put the practice into place. Okay. Put the practice into place. So we had a client, they were complaining of severe pain. So we want to give them a medication that's going to address that pain. Now, here's the thing. You got to know, or you would want to know what these medications are, each one of these medications. Okay. Each one of these medications. So take a second and write down the ones that you're not familiar with, just to write it down. Okay. Because sometimes NCLEX instructors will put distractors. They'll put distractors on the exam. And so we definitely want to just be aware of the major medications, All right. Oh, I'm so happy you guys are here. That is an example of a case study. You know, and somebody said, talk about the changes on NCLEX. There are not going to be any changes on the current NCLEX. All right. So the NCLEX as it is now, it will remain this way for until 2022. It's going to be the difficulty level. It's going to be the same presentation of questions, but they're doing research now to make drastic changes to the exam. Okay. And I was actually listening to a talk about educators and how educators need to prepare for the NCLEX. And it was literally said, like, the way that they're going with the new exam in the future, not now, guys, in the future, but they want to make it so that there's no strategy that will be able to help you to figure out the question. There's no tricks or hacks and people that say, oh, you know, the 10 things you need to do, just the 10 things you need to memorize. Like, the way that the NCLEX will change in the future, no strategy will be able to, no decision tree. Like, companies are going to have to abandon what they've been telling nursing students in order to really have any kind of credibility on the way the NCLEX is changing. So what I can do right now for you guys is just continue to be the best NCLEX instructor in the world. And that's just to prepare you guys to think using what you've been studying. All right. Because it is one thing to just memorize a whole bunch of facts, but it's another thing to be able to critically judge what is happening. All right. So Remar nurses do that. All right. So this is the thing about studying. When you see something you don't know, the expectation is that you always look it up. So even if you read something in Quick Facts and you see it and you just read it and you think, okay, that's good enough. No, make sure that you know. Because the thing about Quick Facts is that the facts are quick and they're supposed to be a review of what you already know. So it's your responsibility to make sure that no matter where you're studying, if you see something and you can't accurately describe it, honestly, I think that if you can't teach it to somebody else, then you don't know it. And so as a part of Remar Nurses, really, when you guys come together, you're sharing knowledge. You're becoming educators yourself. And I'm not doing this every day so that you guys can just continue to eat and eat and eat and eat and eat. No, I want you to learn how to prepare a meal for somebody else. Okay? And that's what I see you doing for the most part. But don't ever get into a comfort zone where it's just that, okay, I'm just going to take this all in and it's like a woman, right? The woman who is pregnant, right? And after 9 months, you carry a baby. At some point, the expectation is that you deliver that baby, right? And it's just like that with ourselves. Like we take in all this knowledge and we just get bigger and bigger and bigger in our own minds. And we don't ever produce something. So you guys are producers. All right. You're producers. All right. So all of this must start with the ability to be able to study independently. Okay. No matter what you use, you have to be in control. You have to be in control of your education. Okay. All right. All right. So, all right, here we go. This scenario, all right, this scenario was acute pancreatitis. The client has symptoms of severe epigastric pain, which radiated to the back. Pancreatitis is also associated with nausea and vomiting. The client alerted the nurse to Cullen signs. So when you're studying pancreatitis, when you go back and study it, all right, when you're studying pancreatitis, make sure that you know not only pancreatitis, but also know the appropriate diet, know the treatment, and know the risk factors associated with acute pancreatitis. All right, and these are all things that you can study right away. All right, right away. Okay, so this was just an example of how you can take very basic information, all right, very fundamental information for nursing and turn it into something complex and difficult. And that's exactly what NCLEX does for us. Okay, that's exactly what NCLEX does. And so it's important that you guys come here and you study. And I like that you build up those muscles, so that you're able to, really focus on what matters. Really focus on what matters. Okay. So, I guess I'm doing this announcement. For the winner, who we will be paying for their NCLEX. The winner is, yes, the winner is right here. Thank you. N. Jacob from New York, RN. We're paying for NCLEX. Yes. It's a good feeling. You invested in yourself. You were randomly chosen. I'll say that again, randomly chosen. So we're going to pay for your NCLEX. Take that burden off of you. Hopefully it allows you to test with a little bit more relaxation in mind. How do you enter? We are paying for NCLEX for somebody every week. And the way you do it is just you invest in yourself, get the DVD, self-study program, invest in yourselves, and you will be entered into that wonderful drawing where we will pay for NCLEX. I mean, when you take steps to invest in yourself, we want to be there to cheer you on, to congratulate you, to encourage and motivate you. That is what we do here at Remar Review. So congratulations. You will be receiving an email from us. But Remar Nurses, remarnurse.com, invest in yourself. You guys are studying. Some of you are studying, you're watching, but you don't even know what the 5-star quick facts is. Oh, no. Shame on you. The 5-star quick facts. I'm telling you, this book should be in every nursing student's bag everywhere. Every working nurse in America needs to have this book. So invest in yourself. If you studied, if you liked it, again, the scenario came right from this book, 5-star quick facts. You can get it at remarnurse.com. Make sure it has the 5 stars on it for the most updated version. All right, updated version. So you guys, thank you again. The motivation today was brought to you by my grandma on behalf of Grandma Lilly. All right. Thank you for taking some time to study with me today and be motivated Again, if you have questions, comments, feel free to reach out to us, support@remarreview.com, and your email will be answered in the order that it was received. All right. So congratulations for everybody who's taken the 6-week challenge, whether you're just starting out, you got the calendar, you're studying along with me, or you finished the program. Congratulations, and you're taking your NCLEX exam very soon. Prayers are with you. People are calling for prayer. I can pray. Mark is not here, but I will pray if that's okay. We'll just say a quick prayer. She said, somehow I have 2 quick fact books. That's all right. That's all right. I have quick facts all around me because I write notes in them and then I just keep them with me. So yes, we will have closing prayer if that's okay with you guys. We're going to have closing prayer, and we'll just pray for everyone who is testing on this week. We would just pray for everyone who is testing on this week. I don't know what's happening here. There's some things that happen and I'm not really sure. No? Yes?
Yo, what's up?
Oh, wait, it's a lot of feedback. Hold on a second. All right. Can you hear me? Can you guys hear Mark?
Can't do it.
No? I can hear you now.
It's
good.
Audio. It's reverberating.
But now it sounds good.
Can you hear me okay right now?
No, it sounds like you're talking in a megaphone.
If you can hear me, put one hand up.
I can hear you.
Wow, you can hear me right now.
Mm-hmm.
Awesome. Perfect. Cool. I just had to mute it on my end, so I can't hear what I'm saying, but I know that I'm speaking and you guys can hear me, so it's awesome. So I heard the call for prayer. I'm actually at home still, had to work from home this morning to get some things accomplished, but I'm always in the background, always on duty. No matter what's going on, make sure that everything goes as best as possible. So thank you all again for the love and the support that you poured out for Regina's family and our family in the passing of Grandma Lilly. And it was just such an inspiration to see all the love in the community. And not to take the time and, as this is like a unique thing, but, we've all suffered loss. You have as well, and within your family, might even be dealing with that situation right now as a caretaker. And you're studying and you have all of these things going on. So we want to just go ahead and take the time and pray. All right. So without further ado, come on, guys, let's pray. All right. Father in heaven, thank you once again for just being attentive and to be able to hear the hearts and the prayers of your people and your children, Lord. There are the nurses that are testing this week. There are nurses that are wondering if they can even have the resources or the help they need to pass this test. I ask, Lord, that you just put the thought in their mind and the stillness in their heart that you have everything in control. Everything is in your hands. There's nothing that gets by you. Nothing takes you by surprise. And so if we can have that peace and that understanding, then we know that everything that we're facing is okay because you are the author and a finisher of our faith. So, Lord, we thank you for being that good shepherd. Watch over the nurses, Lord, as they study, give them peace in their household so they can have the freedom of mind to study. And then also, Lord, as they study, ask, Lord, that they would not neglect their relationship with you, that you would pull them in even as they're pulling in for their license, that you would be grabbing them even as they're reaching for this goal. This is our prayer. In Jesus' name we pray. Amen.
Amen.
All right. Thank you, guys. Oh, stay right here.
Stay right here. Close. I can't because I don't know if they can hear me. I'm assuming they can hear me, but I can't. So you got to say bye.
Say it again.
You got to say bye to everybody.
I got to say bye. All right. Bye, everybody. Love you. Take care.
Okay. Thank you, Elder Mark. Let's see. Okay, guys. So again, if you have any comments or concerns or questions about anything that's happening with your exam, or if you're studying with Remark, don't forget, hit us up, support@remarkreview.com. And we will be happy to hear from you. So until next Monday, guys, we must pass NCLEX. See you guys later. Bye-bye.